Hey, how are you? Yeah, sorry, we're a little backed up here, so I know you've been waiting for a little while. Yeah. Now, you saw the nurse? All right. All right, let me just. Can I have your last name? Thank you. All right. Called that up. Yep. All right, your blood pressure's fine. You do have a fever. Yeah. It says here 101.2. Yeah. Your head's bothering you as well. You have a headache. Bad headache, yeah. And you do have some pain when urinating. All right. Your throat's bothering you too? It's an interesting combination of symptoms, but first things first, we got all the information there, the blood pressure, we got your temperature. All right, so I want to just look in your throat real quick. Yeah. Yep. All right, just open wide. Yeah, your throat is a bit red, and you do have like a canker sore on about the tonsil on the right side. So I want to look at that again in a few minutes, but for now I want to deal with your other stuff that's bothering you. So you have a headache. Do you suffer migraines? Yeah, so that could just be that. But the reason you came in at this time of night at 2 a.m. is that the fever and the pain when urinating, and you do have a pain in the abdomen as well. All right. All right, real quick here. Just so I can add on to this little file here. All right, well, I do want to check a few things here. I want to feel around your head, feel around the throat area, and I'm going to want to, just press in on your abdomen and stuff, so. Yeah. Got my gloves here. Yeah, we just opened a fresh box, so they're a little stiff. Sounds weird. Appears I ripped the bottom of this one a little bit. That's no problem. I'm a little rough with the gloves. You know how it goes. All right. As I was saying, I just want to feel around your head a little bit. Back here. Yeah, just tilt forward towards me. It doesn't hurt. All right. I want to go a little higher. What about that? Doesn't bother you? I want to feel around the temples as well, because pain, where is the pain exactly? Like, is it everywhere? It's in this temple, it goes down a little bit. All right, let me feel around the temples. Oh, you got a little pain there? Okay. All right, well, you do obviously have migraines. You said you suffer from them. Have you taken anything for them? You've been on Topamax, yeah. People they'll get prescribed. They'll prescribe seizure medicine occasionally as well. Did it work? For a bit, and then it stopped. All right, yeah. There's a few other things you could try for that. Like, I mean, I can write you a prescription for some, aspirin, not the over-the-counter stuff, some higher grade stuff. Oh yeah, that worked for you in the past. You were here a year ago. Yeah, that worked. Yeah, it's not something that you want to take all the time, but take it occasionally because if it did help. Yeah, but it's not something you can take every day because it will mess up your stomach and everything else. There will be long-term effects for that, but I can put a prescription in for that for you. All right. Well, you said it went down the neck too. All right, I just want to feel around the neck there. No pain. And even into the shoulder. That hurts, huh? When I push into the shoulder blade area. Huh. That's interesting. I wonder if there's possible nerve action back there that's been bothering, that's causing them to flare up occasionally. What's another thing then we can do here as well? We'll do that after, because we're just dealing with your headache right now. You know, you got a couple different problems going on. And then the fever isn't because of that, I don't think. Headache could just be one of your headaches, but you know what? Bring it up since you're here. Yeah, you know, I mean, it is what it is. But I can put out that prescription for you. I'll do that in a little bit. But for now, I want to just, lay down flat. I want to just, lift up your shirt a little bit. I want to feel in your abdomen. Just tell me if you have any pain in there, all right? Nothing there? About there, no? What about that? All right, you got a little bit of pain on that side, the left side. No, I don't feel any bumps or anything. Your kidneys are over there. All right. Like I said, these things get a little rigid and stiff, but yes, you obviously you have a UTI. I would assume that. You have the burning. How long has it been going on for? Started about 2 weeks ago. You started drinking a bunch of water. Yeah, that's smart. Kind of went away. It came back. Yeah, I mean, it's something, you could maybe flush some of it out. It's good to drink that water because you keep flushing the bacteria out, but sometimes you're just going to need medication. If these things last for, more than a week, 2 weeks, you're going to probably need medication, which I can do that for you as well, obviously. Yeah, absolutely. All right. Well, like I said, you have a little bit of pain on the side, so while we're here, I don't know, it could be related to it. It is in the kidney area, but you said that pain just kind of popped up. Obviously, when I was pressing on it, so it's not something you felt beforehand. No. Well, while you're here, let's be cautious and stuff. So, I want to get your head scanned first and foremost. Just do a head scan, just see. Have you had any before? 2. One of them from here. How did that? Did they find anything? That's interesting. So your one eye was a little more oblong shaped than the other. That's interesting. It's on the side too where you get the pains. That's actually really interesting. I've not heard anything like that before. You might definitely want to see an eye doctor. Maybe they have a little more insight on it. It's not really my area of expertise. It does sound interesting. I don't know if it has anything to do with it. It could just be, people have different shaped everythings. There's no, so many imperfections on everybody's bodies inside and out. That nothing's perfectly fine-tuned or anything like that. Yeah. All right. Back to that thing in your throat. I just want to look at that again. I want to actually take a little bit of a sample of that. Yeah. All right. Yeah. Let me take a look in there again real quick. Okay then, well I'm going to have to get in there with something because it looks like it's popped a little bit, so there's a little bleeding in there. Yeah, no, it's not. It's nothing to worry about. Yeah, just, let me. Yeah, take that. Just spit up in there if you feel like if you can feel the blood going down in there. It's not completely burst or anything, but, it's something concern ourselves with. All right, well, I want to get in there though real quick. I want to take a little sample first. All right, so just open your mouth again. All right. Do a little swab with that, and then I also would like to we can seal this up right here. All right, yeah. All right, take this. I want you to swallow this. It's going to numb your throat. It's going to feel weird. You're not going to be able to really, like, you'll be able to, it's going to just feel weird. You'll be able to open your mouth and stuff, but it'll be very strange. You won't be able to talk for a few seconds. You'll be able to talk for a few seconds, but it'll be just a very odd sensation, but it's nothing crazy. All right, just take that. I just need to heat this up a little bit. Cauterize, yep. That's what we're going to do. All right. All right, here we go. Open up big. You feeling that effects of that? It's numbed? Perfect. Okay. Yeah, that's all you need to do there. It's already, sealing itself up. I want to take that one. All right. I want to take the other one just to put a sample and see if it's something, I don't know, have you suffered from these in the past? You have gotten them? Yeah, all right. It could be some kind of, bacteria or a little bit of a virus type thing. We'll find out what it is. It could be just something that's reoccurring. It could be something we could treat and possibly get rid of. All right. I need to just call this up here. Just want to put in a few little things. Alright, so I'm going to put you in for the aspirin. You can pick these up right at the Walgreens across the street if you want, or you can tell me where your other one is if you just want to get the stuff immediately, because you're not going to need refills on this, so it's not like you have to come all the way back up here again. Alright, cool. So I'll send it to right across the street. That's the aspirin. And we're going to do a 7-day treatment for the UTI. Yeah, we'll do some, Cipro, just 7 days of Cipro. Alright. Those two have been sent out across the street. They'll be ready before you get out of here. You probably, like I said, I also want you to, we're going to check your head, and I want to get a scan on this shoulder area here. Have you ever had one done back there? No? Alright, yeah, maybe maybe there's something going on back there as well, that maybe like a pinched nerve or something in there that's possibly causing part of the cause of the headaches. It doesn't mean it's the full cause, but we'll see. We'll put you in for that. Just fill out a few more things. Has this been, like, it's been really bad pain down there or no? No, yeah, but you've obviously, you've gotten a, I don't say acute, but it's definitely something that's flared up big time tonight. That's why you have the fever and stuff, which that should go down. Yeah, so that shouldn't be too much of an issue. Yeah. Just drink plenty of water as well. Just keep drinking the water. Just try to stay off of carbonated beverages and stuff that will affect it. Some kind of foods occasionally will too. But the beverages, because that's going right down through the bladder and everything else, causes that problem. All that stuff down there, kidneys, bladder, UTIs, all that, it's all connected, and in both of us, and yeah, and all of us, I should say. But yes, it's all connected. So if you let it sit too long, like a month or something, even longer, it could affect your kidneys and stuff, and it's just a quality of life thing. As you can say, you got a fever and stuff. The sore throat would just be a sore throat. Have you been out in it's been pretty shitty out lately? Yeah, it's possible that was an issue, but yeah. But definitely, we're going to get you down for the head scan. We're going to, I want to also check that shoulder area. And I will talk back with you in a few minutes as well. Yeah. Just to see how it all goes and stuff, and yeah. All right, well, they're going to come in. I'm going to do some stuff, and I'll pop back in here, all right? Yeah. All right, and now I will tell you, it may take a little bit. It could be like a half hour or something, but we'll discuss that, and, your medicine will be fine. Like I said, drink plenty of water because you don't want, if this bout doesn't work, you're going to have to see your urologist. He may need a stronger dose, or it could be something else. Who knows? But, we can pretty much assume that it's a UTI. Yeah. Yeah. All right. Well, just hang in there, hang in tight. The technicians will be over. They'll bring you down. They can read your stuff. They'll give the information. It might be a little bit. Hopefully, it's not too long. If you need to go to the bathroom, just you can bring the IV thing with you, and just go down. It's right down the hall, because you want to flush this stuff out constantly. You don't want to hold it in. You want to flush it out, because holding it also will cause issues as well. So you want to flush it out, flush it out, flush it out. Yeah, you got some water there. You can drink that as well to keep that going. All right, and we're going to test out that swab real quick, but that I'm going to have to contact you, or actually, I'm sorry, I forgot to get that information. Who is your primary care physician? Yeah, I've actually had a few. I've bumped into a few times. All right. I got his information. I know where he's located. So when we get the test results for that, will probably be in the morning. I will send them over to him. If he spots anything, he'll call you and you can come in. But if he doesn't, whatever, it's not going to be an issue. He'll probably call you anyway and tell you that's no problem. Okay. All right. Well, ladies, sit tight. I'll be back in a little while. But yeah, hopefully it's the head thing. Maybe we can find something different. Maybe something with that whole shoulder, and hopefully the Cipro clears this out. All right. Yeah, it's rough, man. It can be rough. I had one a while back, and I got taken care of pretty quickly because you're a doctor in this field. You kind of get on things quicker, and you have access to different things and faster things. But yeah, definitely. It's not fun, and like I said, if you let it sit, it could really affect your quality of life and stuff. Just your fevers, lethargic and stuff, fatigue. It's crazy how much stuff it can affect. But hopefully this all works, and hopefully there's nothing with that swab. But I just wanted to take it since it was here. All right. Well, I'll be back in a little bit. Yeah, just rest up.